So when we consider low back pain, there's four categories that we consider. There's a flexion bias, extension bias, a hypermobile and a hypomobile group, and then a traction bias. So for right now, I don't really want you to worry about the terminology. We're going to get more into that later. It's really important to recognize that low back pain really falls into four different categories. So the first of those four categories we're going to talk about today is a flexion bias. There's some conditions that are common that we're going to talk about and address in our seminar. And those are spondylose, nerve impingement, and spinal stenosis. So here's an overview of what the spondylo group looks like. The first picture, you've got a spondylosis, which is a general wear and tear. So you start to get breakdown here and in the cartilage. And then you start to see the discs bulge forward a little bit. The next one is a spondylolysis, where the disc has slipped a little bit more forward, and then there's a fracture in the vertebral arch. And then finally, the last progression is a spondylolisthesis, the most severe. Even more forward translation of the vertebrae, increased angle here, and that fracture still exists right there in the vertebral arch. Okay, the next problem that causes a flexion bias is called a nerve root impingement. So when somebody says, I pinched a nerve, this is basically what's really going on inside your body. So over here, this is your intervertebral disc. This is a nice tough layer right here. Inside is more of a gelatinous material we call the nucleus pulposus. And right here, there's been a tear in the disc. And that disc material is coming out and pressing against the nerve. Right? And that nerve needs to come between the disc and the bony prominence of the vertebrae. And that pressure right there on the nerve is going to cause pain. Okay, the next one is a stenosis, which is a general term for an abnormal narrowing of the space. Happens in lots of places in the body, not just in nerves. Right here, what's going on? You see this right here? This is abnormal. These are osteophytes, or bone spurs. This comes with just general wear and tear, could be from age, lots of different conditions that cause that. But what's happening is it's decreasing this space. This is much wider space than what for the nerve to pass through. It's narrowing, causing pain, very similar to the last slide we saw. Okay, moving on to the next group, we've got an extension bias. Herniated disc is a common problem. The first picture you see, this is a normal disc. We're looking at the vertebrae top down. So this is the posterior side, so this is where your back is right here. And this would be the front up top. And that's the disc area right here. And this is a normal picture. Moving on to this one, there's been microtrauma to the disc, and the bulge is starting to, the disc material starting to bulge out. In this one, we got a further progression, and that material is really pushed out further, and you can see it pressing that nerve. And lastly, in this one, that material is pushed all the way out, and at this point we call it sequestering. So for the next category, we've got the hyper and hypomobile group. Hyper, remember, means too much, and hypo means too little. We are only going to address a hypermobile group in this seminar. Hypomobile requires a PT's intervention because there needs to be manipulation. So some of the causes of hypermobile group would be muscular instability, muscle imbalances, muscle guarding, postural distortions, and arthritis. So here's some common problems that are caused by muscle. First one being overuse, so that'd be from work, maybe a person who works on a dock and is constantly doing this motion all day. That would be an overuse injury. You also got underuse, poor posture, sedentary lifestyle, which really goes together with underuse, and then vertebral dislocations. And here is an example of some postural distortions. In this first picture, we've got an ideal posture. Linear, and you also have four curves in the spine. We've got a kyphosis, into a lordosis, into a kyphosis, and back into a lordosis. In this one, you've got rounded shoulders and an anterior pelvic tilt. So when that pelvis tilts forward, it's going to exaggerate all the curves. So you got more kyphosis, more lordosis, more kyphosis, more lordosis. Moving on to the next one, we have a posterior pelvic tilt. So that pelvis is tilted this way, and it flattens out that back. And in the last one, you've got rounded shoulders and a posterior pelvic tilt. So you also have the pelvis pulled back, and the shoulders have been rounded forward, creating that kyphosis. You've got a flat back into a kyphosis.